All right, welcome everyone. Looks like we have some announcements to start off the meeting with.
Yeah, I was just, so for those of you who haven't been by our building, we partnered with the police department and had a graphic artist come in and do a mural on the outside of our building towards the, it's actually for the police department. They're going to have a community outreach center there for youth. And so they had some youth participate in that. They had some art students, various things. It was kind of a nice community event. So if you haven't seen it, it's beautiful, so come on by. It's very colorful. It's very appealing, I think, to the younger people, so I think it will be a really good thing.
Okay, very cool.
So when the police department moves their, when their new space is ready, then we're going to have the community resource officers and some other folks that are left in that space. And so they're going to be doing lots of outreach activities coming up. So that was just kind of a kickoff for that programming that will be coming up.
You put any pictures out on social media or anything? I'm curious.
I'll
have to drive by.
It had media coverage that
Okay.
day, and it was kind of, since it is the police department's thing, they kind of took the lead in doing
Okay.
the social media portion.
Okay.
Yeah,
Very
it was
cool.
cool.
And then school walk-in clinics as well?
Yes, so we did 3 walk-in clinics for immunizations, school immunizations, one in June, one in July, and one in August. The June and July ones, we didn't have heavily advertised as much as we probably should have. We were trying to iron out some details. We haven't done walk-in clinics quite like this before. So typically if somebody has an appointment, we look up insurance, we find out everything they need before they come. And this was different because we did that when they came. So we were just ironing out some details. The August one, we had a great turnout, and we have also added some more immunization times in our regular clinic that are filling up fast as well as students are getting ready for school.
So for those of you that don't know, for the Fargo Public, they have an enforcement date of October 1st for immunizations. So kids have to be compliant or have exemptions on file in order to continue attending.
If I might ask, are we having any measles here? Weren't expected, or that we?
No, not at
aren't
this
having?
point. I mean, the numbers are still quite high around the country, but not so much in our area.
And if something surfaces, what do we do?
Well, we would work with, depending on where the outbreak or the contact tracing led us, the school would probably, for those kids that haven't been properly immunized, we would have to maybe exclude them from school if the outbreaks occurred in school, working with the state health department to do contact tracing and kind of figure out, where the infected person was and what we need to do for prophylaxis and all that. But yeah, measles is contagious pretty highly, so it would take some coordination amongst many organizations.
So Fargo Public Schools has an enforcement date of October, and do any of the other schools in
Yeah,
the
I
county
think-
have any?
I think West Fargo does as well. I know that, so state DPI sent out a letter through the North Dakota Department of Health, and that had the October 1st date is the state date. It's just, I think there's varying levels of enforcement, probably across the state.
Okay.
Fargo Public and West Fargo are pretty good at enforcing.
Okay.
The walk-in clinics, are they just in the Fargo schools, or are you going out further than that?
So the walk-in clinics are for anybody. It was we advertised it as a school-age clinic. It was at our clinic in the building.
Gotcha.
It was from noon to 6 on Thursdays is when we had one a month was on a Thursday. But yes, it's anybody of school age. And we actually found out that it got on the news that morning. They had picked it up, and that was when we asked people how they had heard about it, that was a huge way that they were aware of our clinic. So we're hoping that happens again.
Okay. I think there's ways of
Making sure that that
Yes.
excellent. Any other announcements that you wanted to start off with, Desi? Okay. All right. So next on the agenda, we have the minutes from the May 31st meeting. Do you have any changes? Otherwise, I'll entertain a motion to approve.
So move.
Second?
Thank you. All right. Reports.
We need a vote.
Okay, sorry. So all those in favor, say aye.
Aye.
Any opposed? Okay. Thanks for keeping me on task. All right, reports. Melissa, you have budget first.
Yep, so we handed out a new sheet that was sent out this morning. I did some corrections on the expense side, but a couple things on the revenue sheet that I can point out to you. On the very top line, you see Women's Way, the Women's Way grant, it shows that's 20%. But if you look down at the second grouping called state grants, you see State Women's Way, and that's at 53,000 received. Between the two, we have the budget all in the top line, so between the two, it's actually 73%, not 20% received. And then the other thing I was gonna point out, under the local grouping, shelter detox, that funding is much increased because of Giving Hearts Day this year. So that's where that money's showing up. And then under environmental, we had, the environmental charges is that line item shows 138%, and that's because the environmental has been very busy handling weed complaints and mowing, and then the revenue shows up on the other side, or on the expenses show up on one side, the revenue shows up here. So they've been busy doing that. To date, we're at 44%. Last year at this time, we're at 46%, so right on track. On the expense side, I highlighted a few things just to make it easier to show you. The first one, vets transportation. We now actually today just changed it in the system. It'll be called vet services. It's not just transportation expense. It's any expense we're having in the shelter or the VA drop-in center for those vets. So that line item was changed. Marketing, it shows 527%. All of that is tobacco-related expense. And I think some of the issue with the number being so high there is because of, we have it budgeted, I think, in contract, but it got sent out, it got billed as marketing instead. It's sometimes hard to know if we're contracting with a company to do it or we're going straight to the media company. We do a little bit of both, so it tends to get mixed up. The areas I have highlighted in blue, water and sewer, auto liability and general liability. Those numbers, the percentages are higher, but those are all put in our budget by City Hall. They make a determination. They'll look at it again probably soon and probably adjust those numbers. They usually do. And then, let's see, building repairs. That's all due to the shelter. So you can see we have higher expenses to that building. It's an older building and run into issues there. And then the last one is medical supplies. That large number is mostly due to the, again, harm reduction, a lot of Narcan and a lot of supplies for the syringe services program. So those were our expenses are, although overall, last year we were at 55% and this year we're at 52%. So again, we're right on track. So, any questions?
Questions? Okay. Next, Desi, you have
Yeah, so you guys have the statistics report in front of you, so if there's anything that you see that you have questions on, there are a couple, like I know in environmental under the aquatic, they did some switching of the categories around, so we see some zeros where, the other, it looks like the categories kind of flip-flop, so they're doing a little bit more, or classifying more as consultations rather than the other categories, so it's just a matter of, the numbers didn't really change, it's just they flipped categories, if that makes sense, but otherwise, if there's any other questions anyone has.
Could you explain the increase in the harm reduction services, the number of individuals? Are we doing things differently, or is the program just growing, or the numbers are increasing nicely?
Well, and Jan, I will give her apologies. She meant to be here, but she did have something come up at the last minute. Hopefully she will get here. But I know with the syringe services program, that probably participation in that has doubled, probably more so in the last several months. So that program is more. I think with the shelter and the overnight stays and the time over the winter, because we had such a bad winter and cold nights, they had to open up some more programming and, you know, capacity things and different things like that. Mobile outreach is, you know, how you've heard reports on that, that has had consistently steady numbers. And I think the library outreach continues to be highly utilized as well. So overall, I would say yes, services are up, you know, quite a bit, especially in that syringe services area, which is a really good thing, which means that the word is getting out of these services, and we're having some really nice outcomes from that.
And if I might, Madam Chair, Desi, my sense is that we're still on a path of declining overdoses and more Narcan applications. That's generally the case?
Yeah, I mean, I think with so when people come into the syringe services, you know, it's more, so we're not getting the data from the hospitals as much as, you know, because they're asking. So when they give out Narcan at the syringe services, it's kind of a reportable thing. Have they used Narcan, and was there saves and that kind of thing? So they gather that information there. So it's not, this data isn't the overdose data, you know, from the ERs and things, but it's more talking with the participants and getting a sense.
But the trend is going the right direction,
Yep, the
isn't
trend is
it?
going, you know, but there again, I think what we're running into too at syringe services is, and you and I have had this discussion on the meth, you know, so yes, the opioid usage is going down. And when I was visiting with Robin from our substance abuse coordinator, she, in talking to people, she gets the sense that because there's so much publicity around opioids, so people view that as that's the really bad stuff. And so then they choose meth because they don't hear as much about it, so they think that's kind of the lesser of the substances. And so it's doing a lot of education with the folks that come in, like, neither one is good for you, and this is, you know, let's look at how we can maybe cut back, do different practices, you know, something. So yeah, opioids, I think, is getting well managed, and there's lots of funding for it and lots of funding specifically for it. And so it's really hard then to shift any funding towards any other efforts, which is kind of a catch-22. So, but I think going forward into our priorities and things for the next year, I mean, certainly meth and binge drinking and all those things are probably going to come up for us.
And thank you. And just an update for the rest of the board, the mayor and I have visited, and he has visited with the Attorney General's office. And that's our sense, that we have a looming, growing meth issue problem. So I think our expectation is we'll start putting that more front burner, more awareness to it, more of creating the sense of urgency that we had with the opioid issues, because it is urgent. So we will look for more discussions on that line from us regarding the meth issues in our town, especially.
And Robin had also said, you know, the meth issue is a little bit trickier in the fact that there are no really hard and fast treatment things. There isn't Narcan. There isn't, you know, so there's all these things that would need to be developed as an approach. So I think the initial part is just going to be to educate on, you know, the risks and how we can do better and things. But just so you guys know, that will be something that needs to be developed by a lot of involvement from agencies.
Hence especially the need for harm reduction with some parts of the country where they've just had explosions of hepatitis and HIV with needle use. I mean, we really have to be on that front, And so I'm glad we're aiming that way, and thank you.
Just to clarify, for the Narcan, ultimately, we want to see a decrease in the use of it, correct? Because if we're seeing a decrease in overdose, but an increase in Narcan, then they're still using, we're just intervening.
Right, I mean, I think it's one of those where, yeah, I mean, you certainly want it available.
Right.
But yes, that does mean that people are still using, but I think when they come in for services at harm reduction, I mean, it really is, every exposure with people is an opportunity to talk about, options to quit or treatment options or what, doing things safer.
Right.
And so, yeah, but it does show we're still using it, so.
Definitely. Is there any way to better track the use of other, whether it's meth or some other drug beyond?
They ask the questions there I don't know as far as other facilities what they're, but yeah, I mean, Robin, I think that she had said 80-some% of our participants there are using meth.
Okay. Well, it sounds like we'll keep it on the radar.
Thank you.
Thanks, Desi. All right, Desi also has the next one.
Yeah, so I was just, Justin wasn't able to be here today, but I just wanted to give you just a quick update on where we're at. We're still working on our improvement plan for our FAB accreditation, which our goal is to submit by the end of November. So in doing that, there's several plans that we are working on. One that Justin did was the community health needs assessment that he sent out to you guys, I believe, the end of June, that really just gives an overview and a snapshot of the health of our community and helps us identify, any trends and priorities and need areas. So that is a really nice document. The other thing, we've met with Clay County and Essentia and Sanford a little bit on our community health improvement plan. So you'll hear, so the community health needs assessment is the CHA. The improvement plan is the CHIP. There's all these acronyms that we're using, but so the CHIP will be developing kind of as a community group, and I believe Essentias and Sanfords have already been released, and then we'll work with Clay County and Family Healthcare and some other area partners, and then come up with some priorities if we have specific priorities for public health as well. The other internal plans that we'll be doing one is our workforce development plan that just kind of looks at, overall, what are the training needs of our workforce? Are we doing succession planning, and how many of us are going to retire in the next 5 to 10 years, all of those types of things, and put together some things on that. We'll have a performance management and quality improvement plan, and then we'll have an overall strategic plan, that's an internal document for the agency. So our hope is with these plans, as we get them in better draft form, we will send them out to you, similar to how he did with the needs assessment. And it's just for your expertise and your feedback and your insight, and just to give any comments that you might have. So over the next couple months, you may be seeing those kind of trickle into your inbox. So we would just really appreciate your input on those.
I know in the past you've pulled all those stakeholders together to have joint conversations, anything like that?
Yeah,
or
we
is it-
just did that with the CHIP planning.
Okay.
So we just kind of looked at last year's process and then just starting to pull together. We do have Monday, there is a meeting in Detroit Lakes that Essentia is putting on that talks about I don't remember the name of it. I don't know if you do, Chris, but it's a population-based software that they purchased that just helps identify population-based health issues. And it's meant to be that everyone from the community kind of contributes to this data, from what I understand, to be able to track outcomes. So we haven't had the training yet, so I'm not really sure of specifics, but I can get any information from that on Monday when we go.
I think
I think it's a Minnesota thing. I mean, that's why.
community mission.
Like,
Well, but it's also like Casey Eisenzimmer, I believe, so it's a regional thing, actually, I think.
be great.
Yeah. Great.
I'm sure we'll be willing to provide some feedback, and if there are other opportunities for us to provide feedback and hear some of the, discussion with the other community stakeholders, I think at least myself would be happy to participate in that. It's always interesting to hear the viewpoints of all the different sectors of the healthcare community, so.
Sure, appreciate that.
Any other questions for Jesse on that part? Okay. Update on server training, et cetera. It's Larry.
Okay, Desi asked me to provide an update to the Board of Health related to server training as well as alcohol compliance checks. As many of you know, those are two areas that I provide administrative oversight to. And there's been some information in the media. I've had some brief conversations with Commissioner Strand related to server training and as well as our alcohol compliance checks. And he actually suggested that we bring it forward to the Board of Health for discussion as well. Just to provide some context related to server training and compliance checks. Server training has been around for approximately 20 years, and we have served thousands and thousands of individuals. And they've taken the course, and it's required for individuals in Fargo and West Fargo within 90 days of employment if they are or plan to serve alcohol. The cost to attend a server training class is $20, and they're held typically at Fargo Cass Public Health. Last year alone, we were able to train over 2,200 servers, and the rate that we're going in 2019, we should surpass those numbers as well. Classes take approximately 2 hours, and they are facilitated by a licensed police officer. And then servers are to take a refresher class, and those refresher classes can either be done in person or online. I know when we first developed the online training a few years ago, we thought more individuals would take advantage of that option, but we're finding they're not. Some are, but majority appreciate the hands-on, they appreciate the live classes we're finding. And some of the things that are discussed and taught in the server training class include how to serve alcohol responsibly, signs of intoxication, how to check an ID, how to stop a fake ID and identify a fake ID, the legal liabilities and laws regarding server training, and much, much more. On average, we host anywhere from 4 to 5 classes a month. We have held as much as 8. Typically, our busier times are around May, June. That's when liquor license renewal time is, and I believe many owners, managers are on their employees to get to the class and complete that. We also are able to provide trainings on their site, providing our materials, our trained officers, and that's been an option that some businesses have chose to take advantage of. Evaluations, it's important for all of our public health programs to evaluate, making sure that we are meeting the needs of the community. If there are suggestions, feedback, we need to take those seriously, and we continuously have those evaluations completed at the end of classes. As of so far in 2019, we've had over 1,100 evaluations completed. And again, we take their feedback seriously. And I just want to share with you what our participants are saying about the class, because I know that there's been some comments recently that the class isn't effective, it's not a good class, and there's some other comments, just thrown out there without, in my opinion, substance or data to back that up. I think it's important because, as we're all aware, it's data and numbers oftentimes that dictate our programming. So if we were getting evals that were not showing success, we'd really have to look at how we're doing things and make some significant changes and make those changes quick. But in the evaluation, one comment or question we asked, the content of the server training was about right. And 96% of the participants either rated that as strongly agree or agree. The class met my needs for knowledge and information required to legally serve alcohol. 97% either strongly agree or agree. The class taught me how to identify minors trying to purchase alcohol. 96% strongly agree or agree. The ID checking procedure I learned in this class was very helpful. 94.8% strongly agree or agree. The class taught me some important intervention techniques for intoxicated persons. 97% either strongly agree or agree. And just a few comments that were noted of the many. One individual that completed the course in 2019 noted the course was very helpful, strongly recommend. Someone else mentioned, I thought the training was very clear, thorough, and in-depth. Someone else mentioned the instructor was engaging enough to not make me want to fall asleep, which I kind of got a chuckle out of that. The class was eye-opening and informative, and just one more, love the instructor's enthusiasm. That's why I'm a strong believer in at least the initial class needs to be taught by a Fargo police officer. They are trained to teach the class. They build relationships with the servers, the managers, and many of the business owners, and I think that's a positive thing. Roughly 80% of our servers as a whole in Fargo have met the server training requirements, that they've completed the class within 90 days of hire, they take their renewal every 3 years, and approximately 69% have at least 80% of their servers trained. Would I like to see closer to 100? Absolutely, I would. We're in some discussions with our city auditor, who actually is the most involved with our liquor licenses, chief of police, and others, to talk through how do we get people into the class and what penalties or incentives or however we want to get individuals into the class so we are closer to 100%. And I think it's important that people realize that sometimes when you think of liquor license, you think of a standard bar, okay? And yes, bars, of course, as we all know, serve alcohol. But in the city and other places, that we have hair salons, we have hotels, restaurants, a variety of different businesses sell and provide alcohol. And I will say that many of our what you would consider our standard bars have our highest completion rates of server training and highest compliance check rate. So, and they realize the importance. You know, some businesses maybe have 4 employees. You know, it only takes 1 to not take server training and they're down to 75%, so they're not meeting the 80% threshold. So again, we're in conversations about what we need to do. Should there be more penalties related to if we have a business that does not meet the 80% threshold? Compliance checks. A great deal of work goes into our alcohol compliance checks. We work with the Fargo Police Department. The Fargo Police Department provides the officers. We provide the minors that go in to the business to attempt to purchase alcohol, minors 18 to 20 years of age. It's important that people know that we want businesses to pass. We do not want them to fail. We do not send minors into establishments asking them to grow a beard, to look older, to trick the server into selling them out an alcoholic beverage. If an individual is close to 21, we don't want them to participate in the compliance checks because, again, it's not to have the philosophy, gotcha. We want them to pass. We applaud them when they do. So it's effort we work with the Fargo Police Department on. Per City of Fargo ordinance, we can check businesses up to 4 times a year. A couple months ago, when I checked the number of liquor licenses in the City of Fargo, we were up to 199. I'm sure it's over 200 now. It's difficult to check all 200 businesses once, let alone up to 4 times. So we have met with Steve Sprague, with the city auditor, the police chief, and a variety of others to figure out, are there ways that we could conduct more formal compliance checks? And I really want to focus on the word formal compliance checks. These are the checks that, again, minors will go in, I would like a beer, and hoping that the server cards them and refuses that to them. There are other things that go into what the City of Fargo police do to help prevent underage drinking and binge drinking. During their regular shift, it's not uncommon for them to walk into a bar or a place that serves alcohol. They will ask for an ID if somebody looks underage. It's not part of our compliance checks. We're not involved in that. If somebody appears to be intoxicated, they will assist or intervene. And oftentimes, there is no paper trail or data collected unless a law is broken. So I think that's important to keep in mind as well. So far in 2019, we have checked 62 businesses, or businesses that have a liquor license in Cass County. And at this time, we have an 89% pass rate for alcohol compliance checks. This Wednesday, this upcoming Wednesday, we have a liquor control committee meeting, and we're going to continue to discuss compliance checks. We're going to continue to discuss server training, see what ideas are out there, just so we can get people into the classes and hopefully being able to provide more formal compliance checks in Fargo. Before I go into an ordinance change that has to do with e-cigarettes or e-juice, I'm wondering if there's any questions related to server training or compliance checks, or any suggestions that any of you may have?
Just a comment, in West Fargo, we have formed a liquor control board ourselves now, which we never had. And part of that is some of the enforcement things you're talking about. And we did put a little teeth into that non-compliance on the training for the servers. Sure. And I think it comes down to, like a lot of things, it's the owners that are more the issue, I think, than a lot of the the servers. If the owner or the business or manager is not going to require it, you're not going to go out on your own and say, oh, sure, I'll get that because I know I need to have it necessarily. So, and in our case, and maybe John, they've had the similar experience. It's a small minority of all the license holders, but they're the same repeat every year, and it comes to time to renew their license, and they have to submit the information, and we've had 50%, and it's always a small same group. So I think what we've tried to do, and I believe, I don't have the details on, we're gonna put a little teeth into that. If they are not up to the, I think it's 80 or 85% threshold now we require, they could possibly get their license suspended and stuff like that. So I guess my point is, I think we really need to focus on the owners, managers, and say, this is not a option, this is requirement. Getting a liquor license is not for everybody. I mean, that's,
Right.
especially in Fargo, it costs a lot of money to get a liquor license. And I think that's something they have to understand. This is what comes along with getting that license. And we don't want to have to be the enforcers of this. This is important, so.
I would agree.
If they were at risk for losing their liquor license, that might motivate them to make sure the compliance is there.
Right.
Larry, when this came to the city commission from Commissioner Gehrig a month or so ago, 6 weeks ago, he dropped this topic onto an agenda, and it hadn't really gone through this board or liquor control board. But the sense I got from that discussion was his concerns were there's there's quite a backlog of folks to be, servers to be trained. And then I had the impression that there are, I'm not sure where he's at, or the Liquor Control Board, that there was going to be a discussion about having the liquor establishment industry provide their own training.
Right.
Which I have some real serious reservations about. But I'm not sure where that discussion is now, and I'm not so sure we shouldn't, as this board goes, firm up our position relative to your voice on the Liquor Control Board, so you're not going there and not certain about where we stand on our recommendation.
Sure. Yes, that feedback, that comment was brought up at a city commission meeting as well as in the media. I really struggle with that. Like I mentioned, we offer 4 to 5 classes a month. We will add classes when needed. We have had up to 8 classes. Currently, if you would go online to register a class, you would find that there's plenty of opportunities to sign up for a class. I will say that we do have an issue with no-show rates that we are talking about, as a group. It is not uncommon to have anywhere from 20 to 40% no-show rate. So we have these seats that possibly could be, somebody could use that, that space. Would it help if they all paid in advance? I think it would. And if you don't show, you lose.
Charge them more the next time.
Right, or
Seriously.
some, you're right. Right, we need to have some teeth and some penalty in that. Now, and even with that, I still do not buy the notion that it's hard to get into the class. Now, they might not, if they wait 2 days before a class, oh, that class is filled. Well, if you wait 2 days, 3 days beforehand, but if you notice, in 3 weeks, 4 weeks, there is a class. If you plan ahead, you can get into that class. If you wait until, just like Mike mentioned, if the owner says you need to get in, so it's liquor license renewal time, and we get this huge influx of folks, it might be challenging to get your first or second choice, but can you get into a class? Yes. Can you take oftentimes a renewal online? Yes, if you so choose. So there are options available for individuals. I have a hard time knowing how top-notch and good, I've sat through a couple server training classes, how good those classes are and the relationships that are built, having the industry teach their own classes. Any group can submit an agenda, a curriculum, and it needs to be approved by Fargo Police. I would imagine we have a great working relationship. They more than likely would ask my opinion on the curriculum, and it needs to be approved before they can actually do that. I cannot recall a business ever doing that. After this was presented at, a discussion was at a Liquor Control Commission meeting a month or 2 ago, I had individuals from the industry come up to me and comment what a good class they are, and they don't want to teach their own class. Why would we fix something that's not broken? And it was refreshing and nice to hear those things. So I just felt that, and I'm glad that I was asked, and I'm glad, Commissioner Strand, that we visited. It's good to get the information out there, because I don't feel that it's as difficult as it maybe was presented to get into our server training classes. We will add classes if need be.
Do you have a sense, Larry, that this board should solidify or clarify its position, or are you okay with the sense that we're with you with where we're going and doing how we're doing it now?
I would feel honored. I would feel that it would show a very positive sign that the Board of Health supports this position, and keeping server training and the importance of server training as we currently have it.
That's something we want to formalize in a resolution, or how do we?
Well, and I think too, just to add your comment on that you're not comfortable with the industry taking over training their own people. I mean, to me, that's a little bit of a conflict of interest when you have, it's supposed to be kind of more of like an oversight or regulatory, and you're giving that to the industry that you're supposedly overseeing. So I personally would like that, if we're gonna go down the resolution path, that would also be something I think would be worth noting, is that there's value in having the health department and the police department do this training.
And I have two questions. These compliance checks where we make sure that they're carding, people or checking the miners' IDs, do we do any periodic checks on if they've gotten their server training? Because maybe we wouldn't have that rush at the end if owners were held more accountable to the 90 days, right? You said it's 90 days
Yes.
upon hire. So if they were held more accountable to that 90-day, then there wouldn't be that rush to get into classes towards the end. But tracking that could be really hard.
That's a good question. It is very time-consuming to check all 199, 200 rosters, especially, and I'm learning more and more all the time that the employees, the servers are very fluid. They go to business, and it's hard to check. However, currently we are doing the checks once a year with the city auditors, an idea, and I think we're moving in the direction of doing it more quarterly, having a random sample, and figuring out ways where we can have owners, managers have more responsibility and not so much time for city staff to be doing those sorts of things. So those discussions have taken place. I think we need to do it more often than once a year, and right now, the idea has come up, the possibility of quarterly.
And even if you did 10% of the businesses, if they're not going to know if it's them. I work in accreditation, so this is what I do all day. We want people to be doing what they're supposed to be doing all the time, and at any point, we can come in and check.
Sure.
So if the owners thought, I could be checked at any time, or I could be checked quarterly, that might give them more accountability too.
And with that, what are the consequences if they're not up to date, if the information that's on this document is not accurate, that these employees did not go to?
Then I think their liquor license would be at jeopardy.
And that's why.
That might be harsh, but I mean, I think that's going to be the biggest motivator for them because that is their business.
Right. And I think that those comments are similar to a lot of individuals. That's why we brought our city attorney into our last meeting, and she agrees. She really would like to see us put more teeth in that and have some consequences.
So Larry, right now, what happens when a business fails a compliance check? What occurs after that?
There is a penalty. The first penalty, there's a $500 fine. If the server actually has completed server training, that is waived. If they have a second failure within a year, it's a $750 penalty, $1,000 third, and it goes up. The problem has been, and we've addressed or started talking about this too, when compliance checks first started, or we started to have this collaboration, it was, I believe, an unwritten rule or an understanding that you need to have random checks so a business isn't feeling like they're picked on, targeted, and so on. So we'll check, and then if we check 2-3 months later, again, it's a random check. But we're starting to have conversations, and I guess I'm a firm believer, if somebody fails, next time around, you're gonna get checked again. And again, because you're never gonna get to the third, fourth, fifth, penalty. And I believe that that's a similar understanding or agreement with the folks that I've talked to. And again, it goes way back that you can't target us, or how come you always come to our business? Well, because you always fail,
That's kind of the point of checking them.
Right, exactly.
Are the results publicized, or is this made public?
Yes, yeah, we actually send a press release, our public information officer, our communication specialist.
And it includes the business name, the liquor license owner, whether or not the server received training or not. I think those would all be.
I agree, because I think, doesn't it just usually say how many businesses failed, but doesn't necessarily call them out? I don't know.
It actually does call out the
identifies
businesses, but I think it's something that we can look at. What exactly are we releasing to the public, and should we be adding more or releasing more? I think that's worth discussing as well.
Since we instituted the server training, you said about 20 years ago, did our compliance check, what's it called, compliance checks?
Yep, our compliance checks.
Did that compliance improve as a result of the servers going through the training? You know, do we have data to show the impact of businesses improving at complying with checking IDs? I know DUIs would be really hard because that's if the law is broken, but something to support that, besides the opinions of the people who took the class, but have we improved our compliance checks since they've received this training, or some other data to support the positive impact that these classes have had?
I do not have that data in front of me. However, I do know that some statistics such as, that was in the media, about 49% pass rate. I'm not sure where those came from. I don't know if they're extremely old statistics. I do know 89%. I wouldn't say it's bad. Could it get better? Absolutely. But I don't have those. But it wouldn't surprise me if they are lower. But I think if we start putting in more teeth, I think we're just going to go up from here. I really believe that.
If we were at 49% at some point, and now we're at 89, that at least shows that the training has made an impact.
Absolutely.
So.
Absolutely. And lastly, I just quickly want to go through e-cigarettes.
Excuse me, Larry, I'd like to present a motion if
sorry.
I could first. And before I say the motion, let me run it past you to see if I'm encapsulating this for our purposes. I will be moving that the Board of Health reaffirm its support of server training classes being offered by Fargo Cass Public Health and the Fargo Police Department, and not by the liquor industry. Is that satisfactory?
It is. I do know.
That issue, just that issue.
Yes. I do know in our city ordinance, it does list that businesses, the industry can teach their own classes if it is, just so you're aware of that, if they so choose, but it has to be approved.
Well, we just knocked that end off, and
Okay.
I move that the Fargo Board of Health reaffirm its support of server training classes being offered by Fargo Cass Public Health and the Fargo Police Department.
I think that sounds outstanding.
So I'll present that as a motion.
Second it.
All those in favor, say aye.
Aye.
Any opposed?
And if I might, Madam Chair, you know me, I'll ask my questions that I just want to ask, because I know they're out there. For years, I've had this sense that if there is an issue the public has with compliance checks, it's our using minors in liquor establishments. I just know that's a concern. How do we answer that? Because we're sending minors into an establishment they can't be in.
Can I ask why we don't send 21-year-olds and then they fail if they don't card them? And that's just me, I don't know how these work. Because then at least you're sending someone in that
Legal.
could possibly be 19.
Right.
But then we're not doing that.
Right. I guess my thoughts with the 21-year-old, that it wouldn't be considered legal. I would hope that they would card them, but if they don't, what the server did is not illegal. I don't think it's a good practice. I think it's extremely risky. I do feel that there are individuals in the community that feel that we're setting businesses up when we send people in there. And I strongly believe that we need to have a philosophy that we are working with the establishment, we're working with the business. We want them to pass. We don't want them, to fail. We're not going to do anything unusual, crazy. Just card me. That's what you're taught in the server training class, because we know just yesterday, our tobacco coordinator and the person who was working with our server training classes as well, he had a whole ring full of fake IDs. I can't tell what is real, what's fake. And then he was explaining to me how I can tell what is a fake ID and not a fake ID. They are so creative nowadays, and where they can get them online and in other places. I think our server training classes, our program compliance checks, is something that as a city of Fargo, we need to be proud of. I am not sure what other ways, instead of sending a minor into those establishments, 18, 19, 20 years old, and hope that they card us. I'm not sure of a way to do that. If there's other interventions we can do, I think that's great. I've recently spoke to the police chief, and he says, well, I think we have to keep in mind that we do that, but our officers walk through. We look to see what's going on. We see if there's over-serving going on, if minors, and we'll ask a minor, it's not like a formal compliance checks with public health, but can I see your ID? You look kind of young, and so on.
What do they do with the alcohol when it gets served to an 18 or 19-year-old when they don't check my ID and they bring me a drink? So what is that person then directed to do?
Oh, then the police officer is with them, and then they take it from there, and then they write up a citation, they talk to them, and so on, and start the process.
I guess, Larry, what I'd be curious about is what are some examples of how others do it if they don't use minors?
Okay,
Must be some examples, and I'd be just wanting to vet that.
okay.
That's just my personal viewpoint. I've always had a concern with this, and I know others do too.
Sure.
I stand, and I agree. I think the general sense is that you are working with the industry and not setting them up. But when they get hit, they're thinking, oh, you picked on me, I was entrapped,
Right.
you created a disturbance or a disruption, and it wouldn't ordinarily, but you know it all. But I'd just be curious if there are any alternatives or not at some point.
I will do some research on that.
Thank you. And I'm not saying that critically about how it's working. I'd just like to be able to answer it myself and others as well.
It would, if we have an issue with public perception about how we're doing it, it is worth looking at. And if we had a 21, 22-year-old who would look young, you could still treat it the same way with the officer saying, you did not card this person, they might not be old enough. And then you reduce that public perception that we're using minors. So I can see both sides, I really can.
For the background on the issue as well.
Okay, and just briefly, I just want to share some information related to a new law. As you're aware, e-cigarettes are becoming a real problem with the youth of North Dakota and in Cass County. E-cigarettes are the electronic devices that heat liquid, produce aerosol, and they expel particles into the air. Using an e-cigarette, sometimes called vaping, could be called juuling. Oftentimes, e-cigarettes contain nicotine, flavoring, and e-cigarette devices could actually be used for marijuana and other drugs as well. According to our most recent Youth Risk Behavior Survey, 12.6% of youth are smoking, which doesn't sound too bad. It's actually going down from what it was, but we're finding just under 21% of youth are starting to use e-cigarettes, and those numbers continue to increase. Locally, we are seeing more youth receiving citations for tobacco use. From 2017, 2018, the citations have doubled. We had 32 citations given by usually school resource officers or police officers to youth. So 32 in 2017 to 64 in 2018, and we're on pace in 2019 to increase that. Oftentimes, what they're finding is youth using e-cigarettes. We just had an individual that took a class recently. We offer a tobacco education program course for people who do get a citation using tobacco products. And we had a young person saying, I am addicted. I am addicted to e-juice, e-cigarettes, and they really are having a tough time quitting. And we're hearing more and more of those type of comments from the youth. Another question that I get from folks is, aren't e-cigarettes safer than cigarettes? And my reply has always been, the use of tobacco products, including e-cigarettes, are unsafe for young people. Neither one of them are safe. So why should we care about e-cigarettes in youth? E-cigarettes, of course, as you're aware, contain nicotine, which is a highly addictive substance that can harm adolescent brain development, which continues to develop into the early to mid-20s. E-cigarettes can contain other harmful substances as well. And research shows that young people who use e-cigarettes are more likely to smoke cigarettes in the future and also increase future addiction to other drugs. Recently, there's been stories in the media from Illinois, Wisconsin, Minnesota about some dangers to lungs when the chemicals are inhaled, the devices causing fire, explosions, poisoning from the e-liquid when swallowed, breathed in, or absorbed through the skin, as well as the eyes. In 2019, the North Dakota legislature enacted House Bill 1477, which prohibits the sale of e-liquids to minors, adding that the sale is an infraction with a mandatory fine of $500 to the individual selling the e-liquid to the minor. And the law went into effect August 1st. Fargo Cass Public Health would like to be more proactive and help prevent youth access to these dangerous and addictive products. In addition to this new law, like we mentioned too, just recently in relationship to alcohol, is we feel it's extremely important that the owners are held accountable for this. We would like businesses that sell e-liquids to minors to be assessed a $500 administrative penalty. We're finding that businesses are often the gatekeepers to the e-liquids, and we believe that this added incentives will make sure that these harmful products do not end up with minors. With tobacco, maybe even with alcohol, but I know this is a real issue with tobacco, is if an employee sells a product to a minor and they fail, say, a compliance check, sometimes the owner just says, you're fired. You know, and I think that's a little harsh, because there are times where the person wasn't trained properly, was confused, and we rather the business take more responsibility of making sure their employees are trained. Don't automatically fire them. Maybe there's additional education or resources that can take place, so we don't automatically fire them. On July 15th, 2019, the Fargo Commission approved the city attorney to review and amend our local ordinance related to tobacco use in the sale of minors. And in closing, and then I'll open it up if anybody has questions, comments, or concerns, if the Board of Health would like a more formal presentation related to e-cigarettes, e-juice, one of our tobacco coordinators would be more than happy to present in the future. And I would be happy to arrange that. So with that, that is an update that we'll be working with our city attorney on, but I'm interested in the Board of Health's thoughts, opinion, because again, there's getting to be more and more media out there and research, and it is getting to be a real issue and a problem here locally with our youth and e-cigarettes.
Do we do compliance checks on businesses that sell cigarettes and e-cigarettes?
Yes, we do, and I will be honest, our vape shops have been very compliant. We have not had one fail. We have made it a point with our vape shops and other businesses to stop in there, to visit with them, ask if there's any questions about the law, if there's any way that we could be more of a resource to them, and they've been good to work with. They really have.
Maybe I need a little bit more clarification on the state law and the $500 penalty piece versus what's being proposed in local ordinance. I'm not understanding the difference between the two. Mind
Well,
covering that?
Well, currently with our local ordinance, if you fail the first time, it's actually a warning. And I know our city attorney would like to actually strengthen that as well. It's a 1-year probation is what it is for a first-time failure. If they fail a second time, it's a 3-day suspension of their tobacco license. And then a third fail within a year period is a 10-day. I can recall off the top of my head, we have had businesses, maybe, I don't know which one, if it's a gas station or whomever, lose their tobacco license for 3 days. A 10 days doesn't come to mind. But that's what we're currently doing. So this is quite significantly more. The $500 e-cigarette to the person selling and nothing to the business is the new law.
Gotcha.
I know, it's my understanding, the North Dakota Department of Health and others did not support that or was confused about the logic behind that. And it'd be really unfortunate for a 16, 17, whatever, anybody to sell by mistake e-juice. They're fired, plus you got a $500 fine on top of that. And
The person gets the fine?
Yes.
I thought it was the business.
And this is the ordinance that we would like to see changed, or at least considered by the city commission, so the business gets a $500 fine as well.
So in the course of the compliance checks, if you go to a vape shop and they sell to that person is it only e-cigarettes where the $500 comes into place, right?
Yes, it's the e-juice.
Okay.
Yep.
So then that
Liquid.
person, and so the ordinance you're proposing is for the business to also pay $500?
Correct.
Okay.
And so the person getting the fine, that is state law?
Yes.
So I'm confused by that because the business may not have trained them, and now I'm obligated to pay a $500 fine, but if that's state law,
Right.
I can't change that. Because I really would think that would be the business that would take the hit.
Yeah, there was quite a few questions, is my understanding, in Bismarck when this came forward, and why the business didn't have any penalty as well.
There's probably some legislators who own businesses that sell it.
Could be.
Sorry. If I might ask an obvious question or two, and this is just my sense of it, not all e-cigarettes or vape juices are nicotine. So how do you manage non-nicotine e-juices in the world of tobacco when they're non-tobacco products and no nicotine?
That is a very good question. There is juice out there that they claim does not have any nicotine. My understanding, there's juice out there that don't claim they have nicotine, and they do. But I'm not testing, we're not testing. So what the state law says is e-juice, period. The fact is, with youth, regardless, nicotine, not flavored, it's illegal for youth. Personally, I would like people, adults, youth, everybody, to not use tobacco products, e-cigarettes, and so on. However, it's illegal. It's legal for adults, but it's illegal for youth. And so we're really focusing on youth, and we don't want them to get addicted early on. So they're addicted early on, and the possibility of increasing their chances of starting cigarettes, other drugs, harming development of the brain, and you know, and there's just other things, as I mentioned, with the poisoning and the explosives and so on and so forth of the devices.
Because I have no problem with the youth aspect of this focus.
Right.
But then I get confused about our messaging isn't always consistent.
Sure.
My sense of the vape world is that they've really evolved the ingredients a lot. Like they were starting off with a lot of, I want to say, polyglycol products, and now they're shifting to vegetarian-based juices. You know, so that industry is changing a lot, is my sense of it. And I do know people that, I've encouraged people to wean off cigarettes, adults, and start vaping. And I've seen successes in that. And then I've seen them reduce their nicotine quantity down from a higher amount down to a lower and lower and lower amount. Personally, I'd rather have somebody vaping in that circumstance than smoking. But maybe I just don't have the science to know enough about that. And I'm a former smoker for decades.
Right. And in that case, you were using it to help them quit cigarettes, where
Exactly.
with youth, we don't want them to start to begin with.
And that's why I'm saying the youth discussion aspect here, I'm all on board with.
Right.
About youth and educating youth and informing youth.
Great. I'm happy to hear that, because again, what I am proposing today and what I'm focusing on, and if I wasn't clear, I apologize. It's youth, and youth access is what I'm talking about today. I really want to keep these products out of the hands of our youth.
So you need our support to have a fine to, or the city attorney is considering the $500 fine to businesses as well.
I think the support of the Board of Health would add a lot to moving this forward. I really do.
I have no idea how to bring up a motion, but I would.
What's the penalty for tobacco, leaf tobacco or other?
Cigarettes or chew.
Currently, right now, if somebody sells to a minor, first time, they're on probation.
So that, okay.
Yep.
So would this be consistent with that, or is there now going to be a difference between the two products?
Well, our city of Fargo attorney wants to put some more teeth into this. What that will look like exactly, we're not sure. Just last month, the commission approved our city attorney to work with us, and we haven't had a meeting since the approval, so I'll be interested to see what they suggest and how we should best move forward.
Okay. I guess my advice, for what it's worth, I think we should make it consistent between e-juice
All
products
products.
and leaf tobacco products.
I agree. Because if we have the fine on the e-juice but not cigarettes, then the youth will just move towards the cigarettes.
Okay.
In my,
Okay.
Yep.
Okay.
Okay.
do we need to make a motion? Okay. I'd like to make a motion to support the opinion that the businesses would be held accountable with a fine if they were to sell e-juice or tobacco to minors. Did I say that correctly?
I think so. Do we have a second?
I'll second that.
All those in favor say aye.
Aye.
Any opposed? All right. Thank you. for
Thank you. I appreciate all your support.
Perfect. All right, I know that we've kind of gone over time, so I want to be respectful. I know also that Robin had shared some different committees and bills going through the interim committees at the legislature, so I don't know if everybody got a copy of that. I have a few more that I'll probably add to the list that might be
Maybe
of
you could
interest.
Email those out to the group then.
Yeah, so there's a lot of activity anyway, so. Anything else? Okay. Thanks
There's
everyone
no
for your
public, so
time.
there's no public comments. So,
But we have it on there.
yes, we do.
All right, thank you, everyone.